Good. A little bit now.
Show me that little doohickey you want.
Oh no, we're gonna order this for you. I'm gonna give you an order form for
Okay,
it.
but I want to see if there's on the video.
And this is the part he'll be using mostly.
Okay.
And it's just to save your thumb.
Yeah. Right. Hear that, Amir?
And so I'm gonna go with this now because it's not hurting him as bad. Are you okay with that?
We've got another appointment on.
That's fine enough.
Okay. Am I okay though?
He said that's enough.
Too much?
Yeah.
How about now?
Is that better?
No, it's still.
Okay. Okay. Now the cool thing, look at the dip. Look at the dip. That's not gonna happen in a normal leg. Look at how the dip's staying in.
Yeah.
That's the tissues. That's the tissues that harden, not allowing the fluid here to come back up.
Okay.
And then we're gonna have to do it on this side too.
All right.
Okay. Now this wouldn't happen, and I can demo on you in a minute, Mona, to show you the total difference in what's going on. Okay. So what this does is going to help break this down, so it softens, so fluid can pass back up. Because a lot of veins and arteries pass right through here, and lymphatic, as well as here.
Okay.
Okay. And this is very, very common. Are we okay? I don't know why I asked him. You already told me.
Yeah. My nephew is he's at like pre-med at NC State. He's a sophomore this year, Daddy. And so last summer he interned with an oncologist. But he's always him and his brother have always been real athletic and into sports. So I think at one time he wanted to go into orthopedics, but now he's saying he's interested in physical therapy.
Oh, yeah, those guys always change their mind.
I know, but I mean, if he, if he sees what's going on and how it can help.
The point is that if he does, tell him about active release technique and fascial distortion model, and these tools back here, take a picture of those. Graston technique. Very good at breaking fascial adhesions and stuff.
Yeah, the big one is the one that you used on my leg to fix my knee, on my thigh.
Ralph?
The left side is not, it doesn't bother.
Yeah, this side is, that's why I went to that one first. So what we're going to do is up the ante. You let me know, okay? As it meshes in, it increases it. Too much still? Now?
That's okay now.
Well, I mean, it's not so much about whether it bothers you; it's trying to get the blood flowing.
I know.
Yeah, I think he knows it's a level that's more pain than he can deal with.
Yeah, because I told him, I said, the extremities are your hands, your feet, and your head, right? And so I think his disorientation problems are coming from lack of blood and oxygen getting to his brain. Otherwise, he's perfectly fine.
He is right now very cognitive.
So.
See, and now the other thing he'll be doing, so much so you this all day,
Wow,
is
look at those indentations.
Yeah.
Yeah.
So you're gonna be you'll also be running up it like this, and you'll feel a bit of a burn as you see his lips, and that is to break bands that are pulling the tendinous area out of the bone, and you'll feel like a little piece of leather in there, and you're gonna go up those bands, starting from down here. Right now, I'm just crushing, and then I'm gonna go back later on. How long are you gonna be here?
He's
Thursday morning.
He's going home Thursday, so he's got another appointment at 2-something on Wednesday.
Okay.
I tried to, spread out the time a little bit because I know you like to give a little time for recovery in between.
See, this soft tissue, it's not just the swelling, it's the connective tissue being an issue, which is causing the blood to stay in his feet. And basically edema. Period.
Edema swelling?
Yep.
Yeah.
Now, is that, as I said, I have pain, slight pain from the waist down.
Right now.
Is that connected with this?
Something it can be, but the way your tissue is here, I think it's your gait from your feet that caused this after the surgery.
Well, yeah, he doesn't walk like he used to walk.
Now I think there was a gait change with the surgery and all that. He had connective tissue distortion here.
So that affects his hips.
Yeah, like I have two ladies right now who are doing a lot better after I got home. I mean, really doing bad. But they also got home therapy doing it, and it helped them a lot because the second time I checked the large lady, she actually, this is me doing the band again, going down it. There's bands that run like this, they break, they stick. And when they stick, they pull out the tendinous area out of the bone, and that's where the pain comes. That's where I'm pushing back in. But if you push back in, you don't get rid of the band in here. And a lot of times you can do it with motion, but right now I'm not overly interested in this. It's called a pin and stretch. And you can tell him that the physical therapists that I know that do this are leaps and bounds ahead because they got the extra tools. Because you can do all the proprioceptive work you want, you can do all the rehab you want, but they still have adhesions. They're not going anywhere. I just got two people out of boots who were in for 6 months. Neither one of them in boots after 2 visits.
It's amazing.
Yeah, these people who invented this stuff were top dogs. One of them is arrogant as sin now.
Well, I just think the fact that my dad's in this office and laying on this table, I've moved a mountain. I tried to use rationalization at first, and then it didn't work, so then I just used brute force. And that worked, right, Daddy? I mean, we have, he's got a nephew, my cousin is a rheumatologist, and he was on one of our vacations with us, and he saw it, and he's like, well, there's nothing you can do medically. He said, but yeah, you probably do need to go get some physical therapy. So a doctor in the family telling him he needs physical therapy, and 4 years later, he's finally...
Okay, what I want to do is find out where you live and get a physical therapist up there or a chiro who does ART and stuff like that.
Well, let me tell you, Joyce, I talked to her about that last time I was here, and she found me like 1 or 2 people up there. They're both young women, okay? And I don't think they have the strength you have, and they're young. They don't have the experience you have.
Yeah, but
I'm
Dan,
talking in their 20s.
Yeah, but if she called Dan, then that's who Dan recommends using. I had a woman work on me in ART. She was phenomenal.
All right, well, I mean...
It's worth a shot.
Yeah, for when he goes back.
But I would prefer somebody doing FDM over everything, but ART is great. They just look at it a little differently. They do thumbs like this. I do thumbs in.
Well...
Now, what I also will be doing with him, let me get on this side. Yeah, this is the real slow.
I mean, not that I have anything against women at all.
I know what you're talking about. You're talking about leverage.
I'm talking about experience and strength. Wow, look at that.
Yep.
Going up the leg. That's amazing.
But he's got a lot of this in here, so if you soften it, you should definitely have less edema down there.
Well, it's been building up for 8 years, unfortunately. And the reason the skin's burnt like that, he was here a couple years ago, and we went canoeing, and just down the Metro Hooch. And anyway, he was in an inflatable duck where your legs are out, and I didn't think about putting sunscreen on his legs. With all that fluid in there, the sun basically boiled that fluid.
Wow. Yeah, you know what? You're right.
Yeah. So yeah, his skin has been discolored ever since that trip.
Cliff's problem's getting worse.
Who?
Your buddy Cliff.
Cliff.
Ralph.
Ralph.
I always call him Cliff.
My neighbor?
Yep. Working years back, he snapped his bicep up here.
Okay.
So guess what? The bicep tendon, one of them's here, one of them's here.
Uh-huh.
So the bicep here now is no longer, is one of the big things to hold the humeral head in, not go anterior. And when he's bowling, he's doing that, and that's pulling this out.
Yeah, he said that he might have to quit bowling.
Well, the only thing I do, I got some tape I left at home, but I was thinking about using this tape on it. Start it back here, pull it really tight forward in this direction, where that would give him that superficial ability to hold that in there enough that he could enjoy bowling still.
Yeah, he had talked about maybe trying to learn to bowl on the other side.
He talked to me about that too.
But
only thing I could tell him is that's surgery if that doesn't work for him. And he can't put that on himself probably. He's going to need someone to help him. I don't know, he may could after a while.
he probably doesn't need to go through surgery.
No. He needs to stay active.
He used to fish a lot too, so I'm sure casting, he probably wore something out.
Oh, he ripped it at work.
Oh, okay.
First time I ever worked on him went like this. Said, "Oh, you ripped your bicep." So you have anterior instability where because you don't have the long head of the biceps keeping the humeral head in place.
Well, he'll try whatever you can figure out.
I put it on my table this morning because I forgot last night because I forgot to put it. I already had the alarm on the car in the garage and. Too much?
It's okay.
The guy who invented active release technique, one of the techniques I use, was at West Point, and he got a degree in what you do. He was a pilot for a while. He was with Eastern. So after Eastern fell, he went towards what I'm doing.
Yeah, my dad's not. I mean, he does like research on the atmosphere and like, okay, this is impressive. Do you remember when the space shuttle was a Challenger that blew up with that woman teacher on there? Okay, this was back in, I was still in Raleigh then. So this was in 80-something, right?
No, it was earlier than that.
No, it was after I graduated. I graduated college in 85 and had my first job, and we were having lunch, so it was like 86.
Yeah, that basically they were killed on the ground, essentially.
Yeah, because it blew up when they shot the rocket blew up.
No, they had the atmosphere in that thing was oxygen. Okay.
Anyway, so like at the time I was my brother was in graduate school and my dad was, teaching at NC State, and I worked right around the corner, so we would eat lunch once a week. So the day after it happened, or I'm going to put